Actually, it's still morning, isn't it? Good morning. I had my first meeting at 6 a.m., so I'm sorry that I said good afternoon, but the day's already been pretty long. My name is Carla Smith. I'm the Executive Vice President of HIMSS and absolutely delighted to bring these two fantastic people to you today. This is the third year that we've done Shattering the Glass Ceiling, a session for aspiring females who are aspiring to leadership positions. And today we have with us Ruben Amorasingham and Denise Hines, who are both CEOs of companies and both strong supporters of women in leadership roles, and we're going to have a great conversation with you. One of the things that's really important to understand as we even begin to talk about this topic is having this kind of a session and a Women in Health IT initiative within HIMSS is never meant to be a single gender focus in that only females can be part of this initiative or part of the conversation. And very consciously and on purpose, we invited Ruben to make that point real because it takes all of us to raise the waters for women to be able to get into executive positions. And I know Ruben has a lot to share with you about that. I also just wanted to note that we have our Women in Health IT reception this evening. It is at the Blue Martini Lounge at Point Orlando, just across the street. If you've not yet registered and you'd like to come, we still have some availability, and so by all means register. We'd love to see you there this evening. I also want to note that we launched a brand new award, Most Influential Women in Health IT, and those have been announced, and they will be part of our event this evening, as well as recognizing these fantastic females during our awards gala on Tuesday. And Denise Hines was one of the judges for that award, so we can talk about that a little bit later. So with that, I want to go ahead and introduce our two and start getting into the conversation a bit. So I have two doctors with me from different paths. I'll start with Denise. Denise has a doctorate in health administration, and she is also the CEO of eHealth Services Group, which is in the great state of Georgia.
That's right.
And she is the chair-elect of the HIMSS North America Board of Directors. And while she will not be the first woman, I'm happy to say that we've had women chairs before, she will be the first woman of color as the chair of the HIMSS North America Board. So she has shattered multiple glass ceilings. In addition to being the CEO of eHealth Services Group, Denise also serves as the executive director for the Georgia Health Information Network. And Ruben Amorasingham, who is a medical doctor. He is the president and CEO of Pieces Technologies, which is based in Dallas, Texas. And he is also a member of the HIMSS North America Board of Directors. Ruben is an expert in the development and the evaluation of health IT, the applications of informatics concepts in healthcare, and the use of innovative care models to reduce disparities, improve quality, and lower costs, which is, I know for all three of us, is big reasons why we get out of bed in the morning, is to do good. So I want to turn it over to our panelists for a couple of minutes and give each of them, and Denise, let me just have you start. Just talk to us a little bit about what you do for a living now and how you got to where you are.
Well, how much time do we have, Carla? Well, what I do for a living is, as Carla mentioned, I am the CEO of eHealth Services Group, which is a company I started. And in the day-to-day work, I work with a great team of people who are here supporting me as well. And we are responsible for the operations of the Health Information Exchange Network for the state of Georgia, along with several other business opportunities that we have to do outreach and education for the providers within the state of Georgia on electronic health records adoption, health information exchange, and regulatory education. So that's what I do on a day-to-day basis. Now, how I ended up starting my company is the longer story. I didn't just wake up one day and say I wanted to be a CEO. If you read my bio one day, just when you have nothing else to do, you'll see that I've been in healthcare since I was 18. And I was able to work through several companies and different types of healthcare organizations, including IBM, which was my first introduction to health technology. But what happened around 2008, 2009 is my sister was sick, and we realized that she was not going to be able to take care of her children. So my family and I decided that my husband and I would take the 3 children. So during that year, my family grew dramatically. And I also knew that I would not be able to work a traditional 8-to-5 job. So I had to decide what I needed for my family and what I needed for my husband, my career. I make no excuses that my career is important to me, but my family is a priority. So I decided that I would go and start my own company because I needed the flexibility. And because I visualized what I needed, I started my own company, and the business started coming. And it started coming and growing and growing and growing and coming and coming and growing and growing. And so that's part of the reason why I started my own company, for the flexibility I needed, my work style that I needed, and the control over my career destiny that I needed for me and my family. And that's how I started my own company.
Thank you, Denise. That's really inspiring.
I know. I asked you how much time do we have. That's the short version.
And Ruben.
Thanks so much. That's really inspiring. And so my story is I grew up as a physician, and my specific practice is internal medicine, hospitalist medicine. But grew up as a computer programmer and was always interested in that, and trained specifically in biomedical informatics. What's been interesting for me is I spent almost all of my medical career in public safety net hospitals. Parkland Hospital being a big formative part of my career, and I was interested in how do we use analytics and technology specifically for underserved populations. And so for the past 12 years have been engaged in research using predictive modeling, natural language processing, increasingly artificial intelligence for support of vulnerable populations and making sure that we have the right care plans and other things like that. So when I was training and finished my training, came back to Parkland Hospital, started a research department there, and that became eventually a separate research institute called PCCI, and it's now grown to 50 employees. And then subsequently, about 3 years ago, that research organization then created a commercial for-profit organization called Pieces Technologies, which supplies the software that was developed at this research organization. So we have a big focus on community and hospital partners. For me, to get to this point where we've been able to start these really amazing organizations, mentorship has been critical, and I know we'll talk about that. And also sort of audacity about trying to create that. When we initially created the Nonprofit Research Institute and then the Commercial Institute, we were told many times it was going to be difficult because we were coming out of a public taxing district authority in Dallas County. And at one point, the attorneys had said, actually to do this, Ruben, it's probably not a good idea. You're going to have to get a law passed in Texas to actually make this possible. And so after a day, I was like, why don't we go after the law? So we ended up a year process, and we actually was able to convince the state of Texas this was really valuable for the work we're doing, which is serving a lot of underserved communities. And we got not only one law passed, 2 laws passed to make a lot of our enterprise possible. So personally, I think a lot of what we're talking about today and what's necessary is constantly trying to push the barriers for things that really matter and for things that are of high value, of which this topic is important to me. So that's my background.
Yeah, thank you, Ruben, thank you. All right, so you've learned a little bit about us. Ruben and Denise are very interested in learning a little bit about you. So if you open up the mobile app with me, we're going to do it together. Get into the mobile app. I'll get over to this question here. We have just a couple of questions to ask of you. So when you're in the mobile app and you're on the home screen, in the upper right-hand corner is a magnifying glass. So just click on the magnifying glass and type in the word glass, as in shattering the glass ceiling. So when you put in glass, shattering the glass ceiling will be number 1 and coming up. So just click on that so that you can get into that session. And I'm doing it with you, so it's live here. And then what you do is use your finger and just scroll down to the bottom, and you'll see in green the word poll. Directly underneath that in little tiny black type, it says take the poll. So if you could please click on that, and you see our first question. It's just now coming up on my phone. So how do you describe yourself? And now I'm going to turn this here as we all answer the question. All right. And I got to tell you, just by looking at all of your faces, we kind of knew the answer to that one. All right. So now down at the bottom of your screen, there is a circular arrow. And so we'll go on to this next one of how do you describe yourself as a clinician? Yes or no? Okay. All right, okay. Not quite a quarter of our audience are clinicians. Okay, terrific. And so then our next question that we have for you is to please just help us understand the best role in your organization. Are you in an executive management position, in a management position, non-management, or other? Again, this is really helpful to us, just kind of thinking about who you are so that we can be thoughtful and informed in how we take it from here. So, all right, so about half of you are in management positions. All right, that's really helpful. Thank you. And I think we have one more question. Nope, that was it. That was it. All right, well, thank you. That was easy, and now we know a little bit more about you. The other thing that I want to make sure that you know is that down each of these aisles, there are microphones. And so we're only going to be talking until maybe like about 5:10 after 11, if that long, and then we're going to turn it over to you. We really want to hear from you. We want to get your questions. We also want to get your advice and counsel. If you have been through an experience that you learned a lot from and were able to think that those lessons learned would be applicable to this conversation, we want to hear about your stories too. So get your questions ready so that you can come on up to the mics. So just to get us going here and just understanding Ruben and Denise a little bit better, so I have a question that I'd like to pose to the two of you. How does your experience as the CEO of each of your companies impact how you think about the importance of a gender diverse workforce? Ruben, do you want to take it first?
I'll certainly start off. The areas that we're involved with, which is increasing sort of machine intelligence in medicine, as well as new and novel approaches to bring underrepresented groups and communities into better care plans and planning with the communities, requires multiple perspectives. I think it's challenging work to do, and so certainly, to me, as you build products, as you think about the ways that those products will be used, how they will be designed for normal use within the health system, outside the health system, not having an incredibly important equal perspective from women is critical, and that only occurs if they're your engineers, they're your mathematicians, they're your computer scientists alongside everyone else. So I think that is really critical. And the second part is just at least for us, the space that we're in, which is this, what I would call sort of this high-end data science. You'd be, as a CEO myself, robbing myself of an incredible talent pool if I wasn't more aggressively trying to create a company that wants as many women in senior leadership positions as possible, because there's just the talent requirements that our industry requires is enormous, and so that's just from a very practical standpoint.
Can I dive a little bit deeper into the first half of your response? You were saying about that it's critical from your point of view that you have a gender diverse workforce working on the topics that your company is focused on. Can you help us better understand why is it critical?
Yeah, I mean,
to have females?
Absolutely. I mean, one, certainly from me as from a moral perspective, I think it's incredibly important. But let's put that aside for a second. I think in terms of building great companies, I think, particularly in the technology world, but everything that we do around products and support of customers and client services, there's all what I would characterize as micro decisions along the way. You can, as a leader, say, I want to go in this direction. But all of us in this room know that there's these decisions that are happening throughout, and those minute decisions are consequential without even realizing it. And the question is, when you're thinking about even the smallest thing about a user interface versus who are we trying to serve and why and what's the way to reach, if you don't have full spectrum perspective, which I think is not only full gender perspective, but every aspect of sort of what makes us diverse, in those decisions, then you ultimately won't succeed, I think. And so that's really the critical aspect.
Thank you, thank you. And Denise, how about you?
Well, it's critically important that I maintain a diverse workforce. So in two different roles for me, of course, I'm in a white male-dominated industry, so I've been in organizations where I'm the first or only minority female in many cases in leadership roles. So I have a sense of responsibility to make sure that I'm aware that I have opportunities to create room for grooming the next generation of skilled leaders, that I have in my network of people, I have a diverse group of people that I can draw from and give back to and talk to and bring into the fold for leadership support. As CEO, I also have to make sure that I bring in the best, the brightest to build the business, maintain the business with the skill sets that are needed to do that. And with that, I also have to make sure that I work with a team that can support each other, that we can relate to each other, that we encourage each other to be the best and brightest that we can be. And as CEO, it's important that I find people that are willing to support each other. Mm-hmm. And I find that with women, we have a network of support that, it's hard to describe to a man that, but for women, we tend to support each other in ways that I can call and talk to someone about issues, or they can call and talk to me about it. But again, the responsibility of making sure that the company does well and grow also requires that I'm open to finding the best and brightest. And in many cases, I'm looking for the best and brightest, and I'm able to groom the best and brightest as well.
Mm-hmm. It reminds me of a conversation I had with Don Reichert. He's the CIO at Metro Health System in Cleveland, Ohio, which is a public health system. And Don is very committed in his shop of having a very diverse workforce in the IT ranks at Metro Health. And I was talking with him about it one day, about why. And he really tied it back to the mission that Metro Health serves. As a public hospital, he believes that it is impossible for Metro Health, for the IT team, to be able to deliver the IT that's necessary to take best care of the patients if the IT team is not representative of the community that's being served. So that the business itself, to the points that you're making, the business itself is built, the building blocks are that diverse workforce that you've got on your teams. Does that resonate with?
Oh, absolutely.
All right. So sometimes it takes courage to speak up when you're in a company or in a situation where you see a lack of diversity or a lack of inclusive behaviors to diversify a workforce. Can you talk to us a little bit about the courage that you've got, the backbone to make a business be diverse in the way it needs to be? And what does that mean for you every day?
Well, it's definitely a issue of confidence and courage to speak up. And the advice I would have for anyone is to start with the first level of management. As much as you're comfortable with speaking with a supervisor or the most immediate level of management around you, to let them know that you see something that you would like to have changed or offer input on how to change it. Sometimes managers or supervisors might not even be aware that the workforce is not diverse enough. They are not conscious of the need to have other types of people in that same environment, so they don't look for it, or they don't make it comfortable for others to apply or be in that environment. So just speaking up at least to the first level of management, if that person is comfortable, is what I would recommend first. If that is not comfortable, then human resources is a confidential place to go. Some companies have support phone numbers you can call and report it. But also, we should also be able to talk to each other and get the best advice from others that can help us maneuver the system to be able to report in a professional way issues that need to be reviewed and resolved. So that's the first way I would recommend that someone speak up with full confidence. What often happens, though, is if that person does not speak up and they may end up leaving the company and going somewhere else, and that company may never know that diversity was an issue. And so it's imperative that we speak up and let the company know that this is an issue that needs to be addressed. And most of the time they will, or they'll ask that person to be involved to help resolve it.
Mm-hmm. And Ruben?
Yeah, what I would say is, I mean, I certainly as a man can't speak to how it must feel to be silenced or to feel underappreciated. Mm-hmm. But one of the things I think for men in the workforce that's critical to recognize is that it's one of the analogies I've used with some of my coworkers is we spend a lot of time in recruitment, particularly data scientists are very talented, mm-hmm. and it's a hard group to recruit for, and they often, one of the key elements we realize is if you have more data scientists, they want to hang out with each other because they feel like there's this essential camaraderie. And so I think it's similar. There's a critical mass of women that's needed, I feel, to create that support network, mm-hmm. that because they're just going to understand things in a different way and be able to talk to each other. One of our most exciting achievements for PCCI, the Research and Development Institute, which is attracting really top-notch candidates, is that we're 60% women. And it wasn't like something that we actually tried to do, but once we started developing a certain level of critical mass, it became a place that whose culture and values were influenced by that, and people wanted to be there. So I think it's important to raise your voice, but it's also important to vote with your feet, you know. And one of the things I would advise for people starting out in their career or wherever they might be is, you have a certain amount of calories in your work life and amount of time, and you should pick organizations that really value you and that the leadership is really committed to making that critical mass happen and make sure that female support network is there among all aspects of the company. So,
Ruben, I remember when HIMSS published some research, some compensation research that we do every couple of years, but for the first time in the time that we've done this compensation study, we actually correlated the numbers by gender. And the results were a bit disheartening, where female compensation has actually, the gap between male and female compensation has actually widened in the last decade instead of narrowed. And I remember the conversation you and I were having that inside of your company, that you guys had actually run some numbers. So you want to talk to us a little bit about that?
Yeah, certainly. So one of our most mature organization, PCCI, we've been able to essentially achieve gender parity on salary, and part of that was heavily focused on what's the talent and why are we taking all of our blinders off as we think about adjustments and promotions, and when we resculpt an organization, that has to happen. And the reality is, for executives, there's a lot of opportunities just because of the sheer ferocity of business to continue to make progress, because unfortunately there's tough stuff to do. You have to sometimes do layoffs, very painful, or you have to do reorganizations, or you have to do changes. And each of those, rather than being, I mean, those are extraordinarily hard circumstances, but they're also constant opportunities to move towards a certain point, because you can rebalance and other things. And we found over the years, as those things occurred and as we moved, we were able to achieve some of our larger goals of recruiting and having amazing women in our staff, and achieving salary equity. And what we find is that the overall culture of the organization, the excitement to be there, is really high on both sides, and I think that's one of the benefits.
Right. So Denise, you probably look at compensation carefully as a CEO and as a company that you own, just like Ruben, right? Any thoughts?
Well, I'll also add, Carla, when I was working with HIMSS on the Women in Health IT initiative, we started looking at some of the reasons why the compensation may be less for women who move into health IT. And we found that women who start as clinicians who then move over into technology tend to make less than technology men, predominantly men, who move over into healthcare, because they start at higher salaries on the technology side versus the lower salaries on the clinician side. And bringing those together and comparing, the women on this side will always make less money than the men on this side. So with that in mind, it takes the companies to be more conscious of looking at the individuals, setting a salary range for that position, and no matter which side of the path they're coming in, that there's a salary range that the nurse may get a $50,000 increase to be in that same role, and the technology person may only get a $10,000 increase, but the salary range is consistent among the people applying for that position. So keeping that in mind, and understanding how the roles for women moving up into the executive positions can really impact and keep us at lower salaries. I've also learned over the time, being a CEO, that I also have to speak up for myself and for my team as well, because women, we tend to shy away from being a little bit more aggressive in interviews and asking for competitive salaries. We tend to shy away and not negotiate and think it's okay that I'm getting a 20% increase when the man who is speaking up has gotten doubled his salary. And so what we can do these days is really start looking at salary ranges that are now published on social media, the internet, versus when we first started. We had to physically go down to a human resources department, look at a job board, and apply. I'm telling my age now, Carla. But now people apply online. You can research salaries online and talk to other women who may have been in those positions, and ask, what do you think the salary range should be in that role? But I also think it's important to have that support group of people around you who will encourage you to speak up and ask and negotiate. Banter, negotiation, conversation with someone who can help you speak up and offer support on why your salary should be higher, or why a contract should have greater value, financial value, or other benefits that we need in our jobs.
And I'm going to tee you off of that a couple of points that Ruben and Denise have made. One, knowledge is power. So equip yourself. There is research out there specifically in the health IT field on the HIMSS website. We have that compensation data. We'll be updating it again in 2017. You can also, as Denise said, if your human resources area, you can find salary ranges and stuff for companies. Social media is a great place to find it. So you can get equipped. So that's one. Another one is negotiation skills are really important. There are classes, community ed classes. Many more urban areas have got women's centers, and so they offer classes in the evenings and on weekends of how to negotiate and begin to learn those skills. You can also, through YouTube and through social media, also be figuring out how to do this and role play it. Find a buddy, find a mentor, find somebody you trust who in a constructive way will be hard on you in the role play. Because as people who run businesses, our job is to run a business with a great workforce and run a business, right? So it's all about the money. So having somebody who can role play with you and help. And the constructive is really important, because when you come out of that role play, you need to feel more empowered and more prepared. You don't need somebody who's going to make you feel small and ill-equipped. All right, so that's important. Any other real practical things that come to your mind on this for either one of you?
I'll just add, Carla, that the negotiation of finances does not end as a CEO.
There you go.
I'm constantly looking for business. I'm constantly negotiating contracts. And as a female executive business owner, I have to feel confident enough to go in and negotiate and be willing to walk away, just as an assertive male would be able to do. And it's harder. I have to, even in my role, have someone talk to me and build my confidence up to go into a meeting and be ready to negotiate as well. So it doesn't end at CEO either.
Yeah, my only advice would be to the 4% of the men in the room, from the statistic, would be that we have a lot of implicit biases that we don't recognize. Like, I have a daughter and consider myself a feminist, but you still will have your natural kind of implicit biases that you don't realize. And, I think one of the things is that to the extent that you can reinforce your own direction where you want to go through, clear established values and making sure that you're trying to deconstruct your own implicit biases is really important. I think that the explosion for your company could be very significant.
Yeah, thank you. I want to start encouraging people to come on up to the mics. There's one on either aisleway, and we love the questions, so looking forward to having you come on up. As you're getting, and I want to encourage people, got to get up here now, to come on up. I want to kind of start with a question here for Denise and Ruben. The majority of our audience are in mid-management positions. To get to that next level, what should people do? Who wants to start?
Okay, well, I'll start with just some general advice for anyone, any gender, any race, any ethnicity. Maintain a good reputation, period. That is the minimum requirement to grow and be successful in any career, because you never know when you'll need a recommendation. Most of the jobs that are available or allow you to grow are obtained through networking. So I would just always say maintain a good reputation. But also make sure that you really want to be at the C-suite level or grow from middle management. And I say that because it's been I'll use my personal experience of being a CEO. I like going out and talking and working and being hands-on with providers. But it's very difficult for me to do that and be CEO. So when you move to the CEO level, it's strategy, it's building business, it's looking at a brand, it's hiring, it's managing managers versus the hands-on and being involved in the work that I enjoy doing so much. So I have to find a good balance between getting a little bit of the work that I really love doing and being responsible for the health of a company, along with responsible for providing a company that can downstream provide livelihood for a whole staff of people. So the level of responsibility grows dramatically. And I would just say before, it looks glamorous, but it is hard work to be a CEO and be responsible for other lives.
Yeah. Yeah.
So just make sure that you want it. And,
that you want that
right, that you want that level of responsibility.
Mm-hmm. Ruben, did you want to?
I would just say, I would echo first, excellence matters always. So that is the key. Ultimately, as a boss, as a CEO, you'll do anything for those people that are the A+ staff. You just go all out for those folks, and that matters a lot. And the second is, and this may seem like a cliche, but just the moving outside the job scope whenever you can for a company builds huge loyalty. So being as proactive as you can, even when you're sometimes rejected, that's going to happen. But eventually it'll come through and it'll be very significant. And even for, you may feel you have, management or teams that don't appreciate it, it will come through, either at that company or another company, that reputation, that ability to say, I'm really having an ambition, not only for myself, but an ambition for the company, and looking proactively at how I bring my passions to that. It's just incredibly, it speaks volumes, and people want to promote those kinds of things. And so it sounds like a cliche, but it's so important.
It's so important, thank you. All right, let's go ahead and get started over here. If you could please tell us who you are and your question.
So I'm April.
Hi, April.
And I just want to talk from personal experience and find out your perspective on how you deal with it. So I actually find a more challenging component to excelling in my career, actually other women.
Oh, yeah.
So I recently suffered from an experience where a woman 3 levels higher than me really completely attempted to destroy my own career, I would say. And I went to HR and I worked with HR, and really personally, I never found any resolution. I abandoned the position. So how do you deal with, I find women to be more interfering than men to be. So personal experience in that area, please.
Okay. All right, Denise, Ruben?
Okay, this is a sensitive one because I'm in a room of women, but I think as women, we know the scenario she's describing. And I think it comes from there are so few positions that are available and open to women that we feel very protective about maintaining those roles. We become threatened when we see an up-and-comer who could potentially take our job that we worked so hard to get. And so we find ourselves in those positions where we're not necessarily very supportive of each other, or we're backbiting or doing things that are counterproductive to making sure we all grow together. So I would just say if you had the opportunity to talk to someone one-on-one, try to get to know that person, maybe off-site, and build a relationship with other women prior to getting in meetings and boardrooms, and just trying to build a bond so that the threat of someone taking their jobs or feeling like there's ulterior motives, that maybe that's lessened before you end up working with that person. And unfortunately, it does happen. And it's our own responsibility, everyone in this room that can hear me, to take a look at yourself in the mirror and say, am I that person? Because I think we all, as women, have some sense of that sometimes, where we feel somewhat threatened because the positions are so far and few in between. But we do have the opportunity to start changing attitudes about that and just feel that wherever you are and whatever you're doing, you're on the path for you. And that no one can just come in and take something from you. If it belongs to you, it will be there for you. And sometimes moving into different directions is the path you're supposed to take anyway. So.
All right. How about if we take a question on this side?
My name's Lucinda Riesland, and I've worked in an academic medical center for about 15 years. And so I'm very familiar with that world. I'm familiar with the people in my space. How do you find a mentor outside of your environment?
Great question.
I could start off. You know, I think, so I've been involved with academic medical systems for my entire career, probably 18 years now, so I know exactly the hierarchy, the sort of, the kind of, the slow pace of change, at least on some of these fronts. One thing I would suggest is you're exactly right that it's important to find mentorship outside of your home environment or academic medical environments. The best way that I find, I think it depends kind of on the positions, but frequently where your, let's say, organization, department, whatever it might be, has interactions with external groups, because the biggest thing about academic environments is they're collaborating a lot. Either, and I don't know your specific position, but clearly they're highly dependent on working with other organizations and around research, sometimes around clinical practice models and other things like that. And you'll end up becoming in contact as a result of the function of the organization. And I would see it as, I would say, I think it's valuable to change the mental model from, hey, I'm performing a transaction with this external organization, to, hey, this is a contact with other folks that could be a potential mentors. And I found, and I think it applies to both genders, that it's sort of that quote that from Tennyson, which is, you know, I'm a part of all that I've met, constantly looking at every single business opportunity, because there's very limited time in one's life. Every single business opportunity, relationship, research partnership, collaboration, activity for possible mentorship, because they may show up in ways that you don't expect. And people are very willing to do it. Particularly the best mentors are always very giving of themselves, so I would use all those opportunities.
I'll also add to go to the places where you would like to be. If you want to change to another industry, start going to those association meetings, start meeting people in that industry, and find people who are doing the jobs you would like to do, and begin to get to know them. But as Jenny mentioned in her presentation this morning, that mentors are all around you. Look at the people around you, find what you like about them, something you would like to do better, and learn from everyone around you.
Yeah. I really liked one thing that Jenny Rometty said as well around mentors, was she very purposefully used that word in plural. That we don't need a single mentor, but mentors, which allows us to be able to find mentors for different niches that we're trying to address, so that you're not trying to get everything you need out of a single mentor. Yeah.
I'd say one other thing. I think that's exactly what she says, exactly correct. And the other thing is, there's aspects of being a good mentee. You know,
that is true.
So there's a phrase, you know, old friends are incredibly valuable. Obviously, I'm not getting the phrase correct, but the value of old friendships. And I think mentors are worth cultivating. It's something that is important to do. It's easier to do now with our technology, but it's easier to build a national mentorship network. And it's also important to cultivate mentors over time that know the full span of your career. On my board right now, I have my professor from Johns Hopkins when I was just in my 20s. That's for the last 18 years has been progressively been a mentor. And so whenever I talk to him about something, we're talking about the full scope of my career in that aspect, and those are incredibly valuable. So keep mentors, cultivate them. They all have their various eccentricities. Mentors in plural, I think, are really critical. Look for them everywhere.
Thank you. Thank you for that great question. So we'll head over to this direction.
Hi, I'm Amy Papia. I'm one of those clinicians as a nurse who's moved up through the ranks. And when I first came into IT, they said, come into IT. I'm like, oh, no, no, no. I really can't use a computer, you know? And that was like 20 years ago. And I also had a CIO at that time that felt that the programmers were definitely worth more money than the nurse. I think I proved him wrong because he kept giving me great bonuses and moved me right up the ranks.
Well, congratulations. I'm sure you earned it.
Thank you. It's that healthcare knowledge that a programmer needs from you, and it's that enthusiastic, always looking to learn. I did get in a position, though, where it was the good old boy network, and I felt like I couldn't grow anymore. So what I want to say is don't be afraid to leave. I'd been at my hospital for almost 30 years and decided I can't grow anymore. And went out and became a consultant. And I cried my eyes out. I was leaving friends and family. My family are nurses, PTs there at the same hospital, but I did it, and it was the hardest thing I ever did. And I have grown so much in the past 4 years that I've been gone. And it's interesting because the people who are left behind, I felt were sort of cancerous. And the first question they asked me, because I'm in a book club with the people I left, how often do you say the F word? I said that's not even part of my vocabulary, but it was a part of the vocabulary of the culture I came from. I said, it's not part of our culture. We live by different values. I believe in them. So I guess I'm just here to say that I've had that CIO good old boy network. I've had that boss, that woman that will tear you down and be nice to the man that's sitting right next to you. And to grow and be who you really are, don't be suppressed. Move on, because you have a lot to give.
That is terrific advice. Thank you. Thank you for sharing.
And Carla, that is exactly what you said, is know who you are. Know when you start feeling that you are not, you're doing things that are outside of your character, that you're uncomfortable, then it is probably, those are signs that it's time to move or grow or change something around you. And what I often find is that, for me, I try and visualize what I think is next. But even visualizing, I tend to do that in what I think is comfortable for me. And another thing I learned from Jenny this morning is we tend to try and stay in our comfort zone, but growth is uncomfortable. You have to be uncomfortable enough to want to grow. And so your point about knowing who you are, if you're out of character with who you are and you're not feeling good about yourself when you go home, your intuition is telling you something needs to change and be different about where you are, what you're doing.
Thank you. All right, let's head over to this side.
Hi, my name's Debbie. Denise, you touched on this about how women bring or create their own little support network. And it made me think of something my mom shared with me about the Pope indicating how we need women in our church community because they bring compassion. That's right. And that's just something that men can't do. I'll put that in quotes because it's not all true. So it led me to that thought. So Ruben, I'd like to hear maybe a little bit more about your experience in that regards, but also with maybe that great strength of compassion, what might be our weakness behind that so that we continue to develop and grow that aspect of it and not forget that, because we do need to balance ourselves. So.
Oh, that's a great question. I think there was a recent study also that outcomes are, and it's early sample work, but outcomes for women physicians sometimes is better because they have that. The compassion that they bring to the clinical encounter is so strong. And I think a lot of my male colleagues and physicians like myself would absolutely recognize that component, so it's so important. I think that I think it's related to the last question. I think my personal view is that if an organization can't recognize the importance of female strengths, natural female empathic strengths like compassion and other things, I think that is, you have to decide for yourself how long you want to do that battle. I think, a lot of these discussions are, can you change a whole organization by yourself or something like that? And I think you matter so much, and there's organizations that clearly want women with those strengths. And I think I think making a move, I think that I really appreciate that last comment. I think it's so important to go to places where you matter, because so much of your life is spent at work. And how much can you battle an organization? I think that can happen, and people have had catalytic effects. But people always have to take stock. So that's my first part is, if it's not being valued, you have to really take a look at that. And there's a certain amount of effort and lifetime that you can spend on that. And I think the second thing is that it's about, one of our organization's maxims is we're trying to always amplify strengths and not focus on weaknesses as much. And so one of the questions is, obviously that's a strength. Working on that strength is really critical, and not having to say, I need to try to compensate for my weaknesses. I think that's where people try to be all things to all people, and that's a problem. And again, I think that's, that mesh between an individual's talents and an organizational culture is so important. So I guess more than anything, I would say, I think we shouldn't, women that feel called to that and have that strength shouldn't try to compensate for that. They should just find an organization where that's fully valued and taken into account.
Thank you.
I'll add an observation about compassion, because sometimes we see it as a weakness in the workplace. And, for many occasions, we as women are told, if you're about to cry, you need to step out of the room and do it somewhere else. You don't want to be seen as weak or emotional in the boardroom, because it's used against you later. And so finding the line between compassion and being viewed as emotional and weak has been a challenge for women in the workplace, I would say. So as Ruben mentioned, finding environments that are encouraging for people to be empathetic to others, but also as women, we do have to make tough decisions, and we have to be strong in those decisions, and sometimes they aren't easy decisions. And we just have to be ready to make them and be supportive to each other and our teams. But when it comes to making a tough decision about letting someone go, or something difficult, you're being counseled in a negative way about something, and you just want to, show some emotion, it's a fine line there. So it's a challenge.
Absolutely. Yes, over on this side.
Hi, I'm Nancy Ridge, Executive Vice President at Telecom Brokers and founder of Women in the Channel. We're a 501c6 that is dedicated to bringing women in tech together to collaborate to grow our businesses, to support each other as women in a male-dominated industry, and to mentor each other as women and younger women into tech. And we've looked at this issue of the compensation disparity and gender diversity quite extensively. And Carla, thank you for the work that you're doing in this area. It's very important. And also I wanted to acknowledge Ruben for achieving that gender parity. I think that went by without too much fanfare, but that's pretty fantastic. And also, Denise, your comment about the support. I believe that 100%, that it really does matter that we need each other to support each other in these things, because going to school to learn negotiating skills or whatnot is difficult when you're a woman who has kids. You got to pick them up from school. Right. You've got to go to their games on the weekend. You've got families, parents to take care of, and all that stuff. So I think relying on each other professionally is so important. That's why organizations like HIMSS, having these women's groups, are so also important and critical. But one of the things in regards to negotiating salaries that I found interesting is the state of Massachusetts passed a law recently that prohibits employers from asking for salary histories, and California is also considering that law. And personally, I think it's a good way to get around that problem that we described between coming from tech or coming from the clinician side. What do you think about the role of legislation in this whole conversation around parity.
Yeah. I think it's a really
Definitely an
great point.
interesting time for legislation.
Yes.
But, no, I think all tools at society's disposal is needed. So I think certainly legislation, and I think certain states have different, capabilities to do it given, their position on these various things. But absolutely, that's an environmental aspect that would help companies. I think it has to be intrinsic and extrinsic, and I would say that the policy making is the extrinsic part. So.
All right. We have time for one more question.
Hi there. I'm Erin Webb, and it's interesting. The last couple of comments kind of feed right into what I was going to say. Do you have any strategies for those of us who are trying to work and move up the chain, so to speak, for balancing empathy and compassion with making those hard decisions? I also have children at home, and so I feel like finding that balance that works for me is one of the largest struggles that I face.
I don't know that I ever use the word balance. I think as I sit down and look at my work week and my home life, and I just figure out what are the priorities for that week. I'm not at every PTA meeting. I'm not, at every school event, but I am at every game, every soccer game, every basketball game. I'm at practices. So, and my husband, as we're married, knew that as two working adults that we would have to both pitch in and do the work for the family.
And Denise, I want to just pause for just a second. It's not just that she and her husband are raising her sister's children. You and your husband also have children. So let our audience know how many children you have at home.
We have 7 children. And so we literally sit down each week and figure out, okay, who's practice, who's taking who to practice. And for me, what's most important is that when I am there at a soccer game, that I'm not on my phone, that I'm paying attention, that I'm actively participating. So whatever experience you're in, be in it. And your children will see that, oh, mom's here. And they appreciate the time that they have with you. But I don't beat myself up if I can't go on the field trip next week. What I do actually do is each child gets a school event, a minimum of 1 school event each year. So I'm at the school, and then I do school meetings with teachers, emails, as much as I can. But I don't beat myself up when I can't make it. I also have a support system in my community. I'm active in my church. I'm active with my neighbors, my family, so that I can call on someone if I'm running late. Hey, can you stop by and pick the child up from school? Or whatever I need is there. And I'm at the altar praying often that, for a sense of rest and relief and renewal each week. Because you have to release and you have to take care of yourself and exercise and find time for you. Because without moms and women in the workplace, we're no good to anyone else. And we have to make sure that we make ourselves a priority, some time for yourself. Take one set of advice I gave to someone else was, if you can, leave early on a Friday and go to a movie by yourself and enjoy an adult movie by yourself occasionally. Those types of things sound funny, or go get your nails done or pedicure, but you'll be surprised how you're in better spirits when you come home or when you go back to work the next day, because you had just a little bit of time to yourself to regroup and re-energize and take some time for yourself.
Yeah, thank you. Closing remarks from you, Ruben?
Yeah, I mean, I don't think I could speak.
No pedicures there, Ruben.
Yeah, exactly. but yeah, I think that term work-life balance, I mean, it's particularly if you're working in a fast-paced industry where things are moving 24/7 for most of the companies we work at, it is this sort of work-life integration, and as opposed to balance. How do you achieve the appropriate kind of work-life integration? One of the things I would say is that I would go back to that original thing, which is if your employer, if your boss, if your team thinks there's so much value because you're constantly looking for ways to be proactive. So those moments where the family stuff inevitably will come in, and you need, there's a bank account, so to speak, where people are like, she's such a, such a closer, all this stuff happens, always looking for other ways to help. That's the key, is how do you balance it out for those moments where you absolutely need the time for the family. So that would be one of the points of advice that I'd give.
One more thing I'll add, Carla, with time management. When I was also in school working and raising children, I was getting up an hour early before everyone else did to do schoolwork. On lunch hours, I was running to the grocery store to get groceries and running errands as much as I could, typing papers on my lunch hour. And then after work, I stayed an hour later to work on my dissertation. So those types, and after 9, after I put the kids to bed, I got back up and worked on my dissertation work. So the time management and just finding those moments of quiet time where you can do the other things that you need to do to grow professionally and school or whatever your second careers might be that you're working on, find time to do it.
Thank you. Thank you. I want to thank both of our panelists for being with us this morning. And have a wonderful rest of your day, and I hope to see many of you at the Women in Health IT reception this evening. Take care.